Just, I just want to welcome everyone to the Empowering New Nurses show. I'm Dr. Miriam Smith, and I'm so excited this morning because we have a special guest. Now, this guest is a nurse educator. She's the author of the book, and she'll tell you more about that, how it was birthed, how it gave birth. And she will tell you more a little about herself. And of course, this is the Empowering New Nurses show. And I know many of you young nurses, you're there and you're going to be excited because you can glean a lot from these experiences from Nurse Brady Russell. So at this time, I just want to welcome Nurse Brady to the Empowering New Nurses show. I'm excited you're here today, and thanks for accepting the invitation. Now, I would like you to tell the audience a little about yourself and your experiences, please.
Of course. Thank you so much, Dr. Smith, for having me. I am so honored to be just a guest on your show. And, before I even tell a little bit about myself, I do want to say high kudos to you for really just picking up this mantle as a retiring nurse and just sharing from that wealth of knowledge to really empower our new nurses. How amazing that, so absolutely. High kudos to you.
Thank you.
By way of introduction, my name is Lamone Brady Russell. I am a registered nurse. I've been a nurse a little over 2 decades now, so for 22 years, and I've had a little bit of dabbling in various areas of nursing. So I've had obstetric, gynecology, perioperative, pediatrics, some NICU, ER, critical care, observation, telemetry, so quite a bit. Dabbled in some nurse management as well, especially during the COVID pandemic. And most recently, I am now a night educator. A new phenomenon, but yes, I'm a recent night educator, and that's my most earliest vacation.
Thanks for sharing that. Thanks for sharing that. Well, I know you're also an author. I wanted to tell us a little about because my goal is empowering my nurses, not just to do clinical care, but just advance themselves. There's so many different areas
Yes,
you can specialize in. It's not like my time. In my time, we were somewhat limited, because I'm talking of more than 4 decades. So
uh,
in my time, the focus was more like obstetric, being a midwife, being a critical care nurse, being a dialysis nurse.
mhm.
Later on, the nurse anesthetist came into being, but I can remember we were so much more limited. So I have to say, nursing has taken a great, progress. Has been advancing. You have now doctor in nursing practice. You have doctor in nurse anesthetist. You have so much different. PhD apart from that, there are so many specialties within the nursing scope that you can go get into. So I
So
know
true.
you had a passion for nursing. And before you actually tell us about your book, I want you to tell us a little about your background in terms of the school you went and where you're from. That's important because we talk about culturally congruent care.
Oh,
And
yes.
it's important to have a little background because we can't impose our culture on others. We have to research, we
Absolutely.
have to study and know in order to give quality care, high quality care. And that's our goal. All right. So tell us a little about your background.
Absolutely. So I was born in Jamaica. And I'm sure once you say Jamaica, everybody already knows it's the fun island. So
So
yes,
are
I
you
was actually
saying
born in
Jamaica?
Jamaica.
Because we have more than one. We have Jamaica Queens, we have Jamaica
Oh,
Island.
yes.
But you got to be
Yes, the
very
island
specific
of
now.
Jamaica in the West Indies. Absolutely. I had pursued my baccalaureate in nursing there. So I got my bachelor's degree from Northern Caribbean University, formerly West Indies College. And then I moved here a little over 10 years ago. So we were actually in Arizona. And during that time there, I pursued my master's, a dual master's program, actually. So I pursued a master's in nursing with an emphasis in leadership. And I also completed a master's degree in business administration.
All
A
right.
little bit over about 3 years ago, we moved to Texas, and that's currently where we reside.
Wow. So you have the business part of management and you also have the clinical. Man, go for it, girl. Go for it. Okay. So let's hear about your book. What happened? How did it come
So
about?
my book, well, common to a lot of health professionals, um, COVID was a terrible time. Um, everybody felt it, everybody saw it, people had different experiences. And from my personal experience at the time, I was in leadership. I was doing clinical coordinator role, and then I transitioned to an interim nurse manager role. And for me, it was so difficult to see the loss of hope in my nurses' faces, young nurses, old nurses. There was this questioning of, was there value in nursing anymore? What did I sign up for? Is this what it's going to be? You know, and a lot of young nurses didn't come into nursing to see this death and people languishing and this sense of powerlessness. And so when I saw all of that, I wanted to just yell from the top of my lungs that nursing, this is not what it's all about. It's about healing and collaboration and helping others. And so I started to write. And before I knew it, I started journaling and just trying to find what the value in is in nursing. And how do you find your way? How can you navigate this? What are the things that you don't know about? How can you refill your cup? How do you use what your position is in nursing to advance your career? And so before I realized it, it became 200 pages.
Wow.
So
Wow.
I then went on to pursue just some advice from, some mentors that I had in nursing, some retiring nurses, some young nurses, and they were just like, this needs to be in a format that other people can get this advice. And so, I started to collaborate with other nurses and kind of put these love letters, I call them, to different arms of nursing together. And that's what happened. Dear nurse, reward yourself, reward your patient. That became the birth child. So
Thanks for
that's where we
sharing.
are.
Thanks for sharing. And I know that many nurses have been journaling, but you have taken to another level, a higher level. You have put it out there. So where can we find that book?
So we're currently on Amazon.com. So if you just go onto Amazon and literally write in Dear Nurse Book, if you Google it, Dear Nurse Book, you will get the link to Amazon because we sell solely out of Amazon. And we specifically wanted to do that because we were strategic, because we wanted it to be some place where everyone could have access. And Amazon being the platform that it is, you can get it in Canada, you can get it in Europe, you can get it in Dubai, you can get it in a small island. And so we wanted to be at a price point where nurses can afford it, and also somewhere where it's accessible to everyone.
Wow, thank you. This is global because Amazon is global. So wherever you
Right.
are, you can. And someone called me before I even met you and told me about the book. And that was one of
Wonderful.
my juniors. Well, when I did nursing, I told you already, it was a long time ago, but she was my junior in nursing school. And she called me and she told me about it. And I was so excited, although I never met you. And so in doing that, I took my copy. I bought my copy
That's amazing.
immediately. And
Oh,
I've read some of it already. And definitely, I would recommend all nurses to get this book
oh,
because you have identified different areas of nursing that
right.
those persons can identify. They can read up about, although they can read on others, they can read about them themselves. And of
Yeah.
course, I appreciate the part where you wrote about the self-care and to take care of
Mhm.
yourself. That's so
Most
important
definitely.
because most times as nurses, we forget ourselves. Sometimes
Oh,
even
so true.
going to the bathroom, I mean, we might get sick after because we have been putting out so much for others. But thank God
Yes,
that A ANA has really recommended that also that we take care of ourselves. The same quality care we're giving to
absolutely.
others, we need to do that for ourselves. So that is great.
Absolutely.
And thanks again. Thanks again for reaching out. And I'm going to
Oh,
encourage many of our nurses to tell their stories, tell their stories. Because at
yes.
my time when the COVID was at its peak, I was an educator,
Mm.
definitely, and going
Mhm.
around sometimes in the mornings and hearing the codes and hearing different reports, it was unbelievable. And
Unbelievable.
going outside and seeing the trailers out there with bodies and getting report that how many bodies were in the morgue, and then
Yes.
more trailers out there with bodies.
Ah,
It was
mhm.
unbelievable. Going into
Unbelievable.
the ICU and ICU areas and nurses, we don't have the ratio was just unbelievable. There were not enough
Unbelievable.
nurses to care for those
Unbelievable.
critically ill patients. I mean, I was
Yes.
there helping in different ways. I back off that white robe at and just put it away and get back into action.
Yes.
that they're where it
Yes.
belong, right? So a prudent
Yes.
nurse would definitely be a part of the process. You
Yes.
can't be there in white and not reaching out. You have to be a
No,
part of it, you know.
you sure
And
have to be.
so I cleaned ventilators so that other individuals could go, and it were, you know, helping, setting
Mhm.
up the drips, doing all different things in those
Mhm.
times, going and educating
Yes.
and encouraging and listening as
Mm.
nurses
Yes.
unloaded on us,
Yes.
you know,
Absolutely.
training up other nurses also
Mhm.
to sort of prepare them for what's happening, who have
Yes.
not had that type of experience for a long time. So, you know,
Yes.
frustration comes at us where we had to just be strong and be there and help along. And with the help of God, we were successful. I mean, we lost some, but we also
Absolutely.
some were saved, right? So
Yes.
at this
Yes.
time,
Absolutely.
as a nurse educator on night, I know you said you have been, this is your most recent role. So
Mhm.
tell us a little about it. What is it like for you to be a night? You usually be a day nurse, right? You usually be a
Well, I am
day,
a night nurse.
you're a night nurse.
I am
Okay.
a night nurse by choice. Most of my career, I've chosen to work nights. And then you'll even find in my book, there is a letter to the night nurse, because there are
Okay.
pros and cons, but there are a lot of advantages. And so this actually came about with a discussion that I really had with my CNO. And that's one of the things I always tell my young nurses: use your voice to, one, identify a problem, but also come with a solution. And so we kind of were talking about, some of the struggles that we were having and some of the gaps that were identified with the night staff. Because really and truly, in any institution, your night staff is half your populace, if you
Mhm.
think about it. And so they have the same educational needs that the day staff require. The only problem is you have more hands on days than you do at nights. And so we came up with the idea that, let's have a night nurse educator. And so in my position, I offer the same educational offerings that day staff need. We do the same kind of needs assessment. We still kind of do our own, we use a Donna Wright survey to determine what are the needs. How do we address those needs? What's the best way to look at those needs? And then again, the same flow that you would with any educational department. But the key thing at nights is that it's more of a roving approach that I use. So instead of the nurses coming to us for education, I go to them. So I take trifles, I do simulations, we do mock codes, we bring crash cards, and we do simulation of what's in the crash card. What does it look like? What if my patient has a code stroke? What does that look like? We do in, in services on equipment, device, drills. How do I do that stuff? So I go to them. We identify, downtime. So like for a medical unit, their downtime may be between 12 and 2. For an ER unit, it might be between 3 and 4. And so I choose those areas where people can actually come and sit and really improve their professional development opportunities and have questions and have queries about how does this work? What about this? How do I do a master's program and my hospital covers it? How do I use this kind of hotline? How do I use MTP? How do I use this RTO line? Those kind of things that, we want to empower our nurses to be better clinicians, to also be rounded, and to use the opportunities that we provide as institutions, as nurses, and as mentors.
That is great. That is great because, from my experience, I've seen nurses who sometimes they just need a little encouragement to move forward and advance their practice. Sometimes they have their they have their strengths, and sometimes because they're not acknowledged, they don't really utilize them. And so we
Oh,
encourage them.
yes.
Sometimes you might be on the floor, and as you interact with them, you might see some nurses, they're so good at that, but they never had anyone
Yes.
to precept. So we would like approach them,
Yes.
and within that conversation,
Absolutely.
we would say, how about you? We have some new nurses coming on next week. How about you thinking
Yes.
of, you're so good at this. I've watched you, I've observed
Yes.
you are
Absolutely.
helping so many
Yes.
nurses get it. You're a key person
Yes.
here. How about you trying to do?
Yes.
And they might be reluctant at first, but after they start getting it, wow. They say, send another one.
Yes.
Next, when you have new. So therefore, we have the baton being passed on, and we are encouraging
Yes.
our young nurses to be visible,
Absolutely.
and
Yes,
to, as you stated
absolutely.
before, let their voices be heard, because fresh blood,
Yes.
freshness, we need
Oh,
that. We
yes.
need that.
Fresh
The
eyes.
technology,
Absolutely.
we absolutely need that. So as we get
Yes.
them, we train them and we encourage them to advance themselves, find themselves also in
Mhm.
organizations, nursing organizations, governances where they can
Yes,
say, they can express themselves and where the needs are so that we can grow. You know, we don't,
absolutely.
we
Absolutely.
change is a constant word
Absolutely.
now. Change is
Yes, it
a
sure
constant
is.
word. And therefore we all have to be prepared for that.
Yes.
Um,
Yes.
just a little more on culturally sensitive care. Have you
Mhm.
observed anything recently or during your career so far? Like, for example, you have a patient who, say, for example, communication wise, you might be talking to the person, the eyes are fixed on the person, or
Mhm.
in some cultures it might vary. My looking at you, or maybe the way I was trained from my
Yes.
culture, I look you in the
Mhm.
eyes. But have you
Absolutely.
met others that it's not like that in your career path?
Absolutely. Absolutely. And I think most recently, because Houston is one of the most diverse cities really in America. And so we have a lot of various nationalities that come through our doors because we are really in one of the most culturally sensitive and culturally diverse what you call these districts really within Houston itself. And so, you will have that Asian culture where, as a sign of respect, the eyes are lowered. And so you always want to mirror those cultures. You may have somebody who speaks Mandarin. And so we have to bring in the language line where they are able to have somebody translate appropriately what their medical care is, what their post-op care is, what this consent means. And using that kind of option, you can then have them relate clinically in an informed way what the patient expectations are, what questions do they have. So we encourage our doctors, we encourage our new nurses, we encourage our PCs to use those options that we do have and to respect those things. And one of the things I always say, and I really point out to my new nurses as well, that an A-rate nurse is one who's able to really realize that somebody is culturally different than you are. Not every Black person is looking for a fix. Not every Spanish person is bilingual. Not every person from Iran needs a halal diet. And so never categorize people. Not every Caucasian person is going to act like they own the suite. Not every person is like that. And so looking at the person who is in front of you and personalizing, individualizing their care plan to what they need is who a good nurse is. And so it becomes so relevant, especially in this time when you have different orientations and, you have gender associations. And so we have to respect people who may be different in our own personal determinations.
Those Listen, those pointers are so strong and relevant. I really appreciate that because in
Absolutely.
my book that will be coming out soon, Empowering New Nurses, a guide to empowering new nurses, that's one of the segment,
Oh,
that's one of the section that has to do
wonderful.
with, listen, it has to do with culturally congruent care. And it's so, so,
Yes.
so, so important. If you should look on my YouTube
Oh,
also, you will see I've got a lot of ratings for that because we cannot treat everybody,
great.
we cannot use the same
Yes.
sock to put on everyone.
Absolutely.
We cannot, because in
Absolutely.
order to give that high quality care, the cultural part
Yes.
is also an integral part of the care.
So
Must
key.
be. Until
Absolutely.
that is included, it's not total
Yes.
care, you know.
Absolutely.
So that is so great. I appreciate you
Absolutely.
coming on this morning so much and
Of
sharing with us.
course.
But I would like, before you leave, just to tell our young nurses a little few tips of how they can grow and what they can do to enhance their nursing career, because there are so many distractions out there. But tell us some of it, because you'll hear sometimes about the bullying, and some people might never heard of bullying in nursing, but it's real.
Mhm.
It's real. And you
Mhm.
hear
It is.
sometimes a
It is.
statement like the nurse eat their young. I don't know if you've ever heard that, but I've heard that
Mhm.
several times. I went to
Mhm.
Texas last I went to Texas last August. That was 2022. And I was at
Mhm.
a podcast fest movement. And, you know, as I interact with the individuals, it was just so thrilling. However, I've heard more than once individuals saying, my relative left nursing and gone into another profession because they were bullied.
Yes.
You know, have
Yes.
you ever had any experience like that or heard of it? Give us a little tidbit so that the world might know that although it's such a noble profession, not every nurse is the same or give the quality
Absolutely.
or treat others the same.
Absolutely.
So any
Unfortunately, unfortunately, that is true. I must say it has gotten better because when I was a nurse, oh Lord, 20 years ago, that was definitely the new thing. You know, you had to be, you know, grubbed before you got into nursing to prove your worth. And thankfully, I think as our generation and your generation, as we have matured, that is becoming less and less the norm. So I would say for my young nurses, when you're going into nursing, one, have commitment to realize that it's all not rainbows and sunshine. There is going to be that moral responsibility that you have taken an oath before God and before others, and whether or not you believe in God, you have taken an oath to look after your community. So, as older nurses, we're expecting nurses to come in to want to be a part of something bigger, to have compassion for others. So, having the right mindset coming into nursing is such a big key, because you can tell somebody who's there to get the job done, get paid, and get out. That's a big difference. So come in with that positive attitude that I am here to try and hold hands with the people who have gone ahead of me to help improve my world, one patient at a time, one family at a time. That'll be the first thing I'd say. The second thing I'd like to say is have an inquiring mind. No question is stupid. I always tell my students, always tell my mentees, no question is stupid. Always ask, always have that inquiring mind. Why are we doing it this way? Don't be afraid to challenge the evidence. Evidence-based practice has become what drives nursing. And before we had these old wives' tale where we're like, oh, well, you know, we've done it all the time. We've always done it this way. No, let's change the status quo. Why are we doing it this way? Is this way causing more infections for a patient? Is this causing our nurses to burn out easier? Is this increasing our attrition rate? So look at the evidence, look at the data, and find solutions to those things. Always have an inquiring mind. And a third thing I'd say is push yourself. You can do it. Yes, it's not always going to be an easy road, but again, there's so many there's so many resources out there. My book, your podcast, vlogs, YouTube things, experiences that people are posting. We're trying to tell you the inside things, the behind the scene things to help you excel in your career. So take those things, do the research, and look at what is out there for you and pursue it. Determination, that unostentation attitude, you know, always wanting to know more, but also having that sense of accomplishment and using that to empower others, to help others, to embolden others. Those are things I would really tell my young nurses.
Wow, that's a wealth of information. That's a wealth of tidbits that will definitely enhance a nurse, a young nurse, as she pursues in her career. It's so beautiful. It's a wonderful thing to have had Lemon Brady Russell, our guest today, and we look forward to having her. Now, for you to get more information, you just have to put Dear Nurse on Amazon, and you got to get her book, because that is meant for you. That is meant for all of us, because if you should check the different areas, she's identifying each area of nursing, and we appreciate you coming on.
Absolutely.
I want to say thanks again. Thank you so much for taking time out of your busy schedule. Maybe you didn't even work last night. I'm not sure, but whatever it is, for you to have taken time out to share the word of knowledge from Jamaica, West Indies to Texas to Missouri, Arizona, wherever, right? And to the world at large. We say we appreciate you on this platform. Now, we want you all who have listened to her, to Nurse Russell, nurse educator, author, to go on Amazon and get her book. It will help you, and that will inspire you too with your stories, you and you and you. And start writing, be inspired. She has inspired me. She indeed has inspired me. And the way, I know many nurses are writers. So just put that
Yes.
somebody else can learn from your experiences.
Yes.
I want to say thanks
Absolutely.
again for coming on. And I am on Podcast Mirror. You can get me on podcast Empowering New Nurses on YouTube, Miriam Amanda Smith. I'm also on the different platforms. You just got to look me up, Miriam Amanda Smith or Empowering New Nurses by Dr. Miriam Smith. Wow, what a morning. Indeed.
Thank you so much, Dr.
Indeed.
Smith.
And as we celebrate Black History Month, just remember we have
Yes.
come far and we are
Absolutely.
positive contributors to the nursing profession, to the health
Yes.
of the world.
Absolutely.
Thanks again. Thanks
Thank
again.
you so much.
And bye.
Bye-bye.
Bye-bye.